Ladies and gentlemen, let me introduce my presentation about cardiometabolic risk in patients with schizophrenia. Some basic information. Patients with severe mental illnesses, including schizophrenia, schizoaffective disorder, bipolar disorder, have an excess mortality 2- or 3-fold higher in comparison with general population. These patients have at least 20 years shorter lifespan, and this mortality gap is widened in recent decades. The majority of this excess is due to natural causes, particularly cardiovascular and pulmonary disease. And mortality due to cardiovascular disease is doubled in patients suffering of schizophrenia. What are the reasons of higher morbidity and mortality? As can you see, there are several contributing factors. First, metabolic, immunological, and endocrine alteration or dysregulation is present already before the start of antipsychotic medications as some inherent part or somatic component of schizophrenic illness. Second, psychosis itself, particularly some symptoms as negative symptoms and cognitive symptoms and lack of insight may play the role in higher morbidity and mortality. Unhealthy lifestyle of patients with schizophrenia, including smoking, poor diet, and sedentary behavior. Also, psychotropic medications, antipsychotics, but also antidepressants and mood stabilizers play the role. And last but not least, disparities in healthcare. It's important, and there is evidence that patients with schizophrenia have limited access to general health care. They are less often assessed and treated for hypertension, diabetes, dyslipidemia, and other somatic illnesses. We distinguish modifiable and unmodifiable risk cardiovascular or cardiometabolic risk factors, and in this table are shown is shown prevalence and relative risk of cardiometabolic risk factors in schizophrenia and bipolar disorder compared with general population. And these modifiable factors are the goal of our interventions in these patients. There is a visual summary of all components of cardiometabolic risk factors and components according to American Diabetes Association. We were interested how is prevalence of cardiometabolic risk factors and in our patients with schizophrenia in Czech Republic, and we reviewed data from 129 outpatients treated in psychiatric clinic in Hradec Králové, Czech Republic, and the majority of patients was treated with SGA, second generation antipsychotics monotherapy. And as you can see, in this study group, dyslipidemia was the most frequent risk factor in 70% of our patients. 43 patients were smokers, and 16% patients had arterial hypertension. Gender differences apparent only in smoking status, where significantly more males were smokers. There are laboratory and physical data. Nearly one half of patients had cholesterol level, high cholesterol level, and 70% of patients were overweight, and one half of patients had BMI value greater than 27. And which is considered as threshold for increased risk of cardiovascular disease. And very important finding: 1/4 of patients had high risk of fatal cardiovascular event over 10-year period, according to European guideline for cardiovascular disease prevention. So, antipsychotics, treatment with antipsychotics is effective and necessary part or component of management of schizophrenic illness, and the group of second generation antipsychotics is a very heterogeneous group with different occur of adverse events, and some antipsychotics can induce weight gain and metabolic abnormalities, particularly multi-receptor antagonists as clozapine, as olanzapine, and quetiapine. But there is evidence, and it was well established, that long-term treatment with antipsychotics is associated with lower mortality compared with no antipsychotic use. It's main finding from Tihonen large cohort study. In this table are shown approximate relative likelihood of antipsychotic induced metabolic disturbances, and as I told, there are these metabolic agents, and clozapine, olanzapine, and quetiapine, and chlorpromazine. But we know that antipsychotics are only one of several cardiovascular risk factors in patients with schizophrenia. We tried assess or measure cardiometabolic risk in our patients with first episode schizophrenia such as sub-analysis from large ANTRE study, The patients were recruited from psychiatric department of psychiatry in Hradec Králové, and psychopathology and assessment of psychopathology and laboratory assessment and other measurements were performed at 4 visits. First visit immediately before start of antipsychotic treatment, second 3 months later, and 3 and 4 visits, one after 1 and 2 years of treatment. There you can see demographic data of our participants, and the median of age was 27 years in both groups, patients and healthy volunteers. Healthy volunteers were assessed only once at visit 1 for comparison at baseline status. And what did we find? Body weight of study participants, of patients, increased during first year of treatment. The body weight of healthy volunteers is displayed with red line, and body weight reached the peak and then remained stable during second year of treatment. The whole weight gain was very high, 10 kilograms during 2 years follow-up. Glycemia remained stable during first time of treatment in first course of 1 year follow-up, and we detected significant changes between 1 and 2 years of treatment. Cholesterol levels increased during first year, similarly to weight gain, and as can you see, LDL levels and atterogeneity index rise during the first year. Similarly, then cholesterol and HDL vice versa decreased, of course. On the other hand, levels of triglycerides increased during the whole 2 year follow-up. We also measured HSCRP as a biomarker of endothelial inflammation and atherosclerosis risk and cardiovascular risk, and values lower than 1 were associated with low risk, are associated with low risk, and values greater than 3 with high cardiovascular risk, and values between 1 and 3 with moderate risk. And our young and healthy people, patients in our study, at the start of study, were associated, had low risk of cardiovascular disease at baseline, similarly with to healthy volunteers, but moderate risk after 1 year of treatment. It's very important finding in young and healthy peoples people after 2 years, only 1 year and 2 years of antipsychotic treatment. In conclusion, this study shows that patients with schizophrenia have a higher risk of cardiovascular disease even in early phase of illness in first year of treatment. Monitoring and screening and monitoring of cardiovascular risk factors is a very important and essential component of management of schizophrenia, and European Psychiatric Association developed guideline for screening and monitoring, and this table is simplified of algorithm for your better understanding, and medical history and assessments and measurements includes these 4 steps, and measurement should be taken before first prescription of antipsychotics, and the frequency of testing will depend on patient's medical history and prevalence and presence of baseline risk factors, and for normal baseline result is...
Time is up.
Yes.
Okay. Great.
Můžu to ještě ukončit, nebo?
Okay.
As for conclusion, people with schizophrenia have worse physical health and reduced life expectancy compared to general population, and the screening and monitoring of cardiovascular risk factors and diabetes risk factors and prevention is necessary but underestimated. And psychiatrists should help educate and motivate patients with schizophrenia to improve their lifestyle, and then they must cooperate with general practitioners and other specialists. Thank you for your attention.